Over the counter, I take a baby aspirin, which I understand from my neurologist keeps down the risk of heart attacks. I take vitamin D and fish oil, which is again over the counter medication. Crestor for my cholesterol, lisinopril for blood pressure. And lately I've taken these prescriptions that I've gotten, which help me with my back situation. Gabapentin and Tramadol. I spend prescription drugs alone, probably in the course of a year, I would say $2,500. One of the medications that's been prescribed for me is Crestor, for instance. Crestor would run me about $2,000 a year if I was to buy it as prescribed. I've been fortunate that I've gotten samples from the primary physician that I've been able to avoid that kind of cost. My thoughts on generic drugs is that if I can get them and they will do the same thing, then certainly I'm glad to be afforded the opportunity. I can't tell you that they're better or worse than anything else because I haven't had an opportunity to try something else. All I know is that they apparently seem to be doing what they're supposed to do, and they cost less.
Basically, I have all the typical black woman's disease, high blood pressure, diabetes, and I have had cardiac problems and a triple bypass some years back. But so far, I'm doing good. I currently take furosemide, Caludet, Actos, and insulin. I probably spend a couple of $100 a month on medications. If I can get generic drugs, I do. But because of cardiac problems, a lot of my cardiologist doesn't like for me to take some generics. But if they're available, I will take them. I think that preventive health care is probably the major thing and the first thing that people should do. And young folks should be more aware of their bodies and what can happen if they do not. Follow directions of the doctor or whoever your healthcare persons are, diabetic, cardiac, and regular private physician doing what they think is good for you and for your health.
My name's David Fitch. I'm 51 years old. I've lived in Baltimore, Maryland all my life. Born and raised here. I have a vending business. It's called DNC Vending. I've been doing it now full-time for about 7 years. I've had the business for 16 years. We built it from the ground up, my wife and I, right from the first machine all the way through. Now, I met my wife through my younger sister. They both worked at Kmart together. And she was in my sister's wedding and I was in my sister's wedding. And that's how we met. We met in, let's see, it was November, and the following July we were married. We knew each other for 9 months, and we were married. We would have been 27 years. My oldest son is in the plumbers and steam fitters apprenticeship program. He's in his second year, getting ready to go into his third in September. My middle son will be a senior this year in high school. And my youngest son, he's going into 6th grade, so he's going to middle school. My wife was a great people person. She loved people, she loved kids. She went back to work to help out because of the economy. My business started going down. So she went out and she made enough, basically about enough to make the house payment, which was good. It helped take some of the pressure off. And then in January of '09, well, actually she got sick right before Christmas in '08. And she went to the doctors after the first of the year in '09, and they found out she had pancreatic cancer. That was on January 15th, and she passed away June 12th. Just to have an illness, to take somebody out, just out of nowhere. And it's devastating. She just, no cancer runs in her family on either side. And it just all of a sudden, whammo, you get sick, you think you got a virus. Next thing they tell you, you got 6 months to live, if you're lucky. And she lived just about 6 months. And the worst part of the whole thing is watching somebody deteriorate in front of your eyes and you can't do a thing about it. A normal, healthy, vibrant person turn into skin and bones. And you just got to watch it because there's nothing you can do. I miss her. I know my kids miss her. When she got in the hospital and they found out she had pancreatic cancer, the hospital had sent us some information, and we filled out papers and gave them a copy of her tax return and all that stuff and sent it in. And then we had to go to medical assistance downtown, or actually it wasn't downtown, it was another hospital in the city. We went in there and they basically told us that we didn't qualify because we own too much, because we have a rental property. And the woman basically told us if you have anything that's worth over $3,000 besides your house, that you're not going to qualify. So that instantly pushed us right out. And we were told medical assistance is for people that have nothing. The insurance company, even though we were paying over $1,000 a month for health insurance, they wouldn't cover the prescription because it wasn't generic. Well, there was no generic. We'd use the generic if it was available, but there is none. And the insurance companies instantly, well, we're not paying for it. What choice do you have? And when you're paying it, as far as I'm concerned, you're paying $1,000 a month for something, and you have a benefit with it, it should cover it. I'm paying you $1,050 a month, and now I got to pay another $200 a month. Well, actually, when both my children were taken, you were talking almost $350 a month for prescriptions on top of that. So it's $1,450 for prescriptions and health care that I was getting no benefit from. That's more than my house payment. And to me, that's just ridiculous. With business not being good from the economy, it's that for a while it put a strain on us. You figure you have to put out $350 a month for medication that you don't really have, but you don't have a whole lot of choice. So you do what you got to do. A lot of times we were charging on credit cards, and then your credit card just keeps inching up and inching up. You're paying a credit card bill $100 a month and you're charging $350. It don't take long, you get behind the 8 ball.